Hello to all of our viewers. Thank you for joining us today on today's show, Social Security Show with CAN TV. My name is Josephine Mueller and I am a public affairs specialist here in the Chicago metropolitan area. But I am not alone here today. I am here with a very special guest, my wonderful colleague, Miss Megan Forristall. And I'm going to go ahead and pass it over to Megan so she can go ahead and introduce herself and share a little bit about who she is and what she does here with the Social Security Administration. Megan?
Thank you. So yes, good morning everyone. My name is Megan Forristall, as Josephine said. I'm a public affairs specialist like Josephine, and I cover an area that kind of butts up to Josephine's area. So northern and north central Illinois. I'm actually based out of Peru, Illinois. So if you're familiar with Starved Rock State Park, that's about 10 minutes from where I live. And like Josephine, I work with different community partners and advocates to provide Social Security information. Thanks for having me with you today, Josephine.
Thank you for joining us, Megan. We are very excited. I am very excited that Megan is here with us today because Megan has some great updates for us regarding what to expect in 2024. As Megan mentioned, she covers a portion of Illinois. And when Megan and I first started here with the Social Security Administration, we started as individuals in the local field office who would take applications. And so we were some of the friendly faces that you would see when you would walk into the local office. And if you had questions about Social Security's benefits and programs, we were there to answer them for you. But now we have this great opportunity where we are able to share information with the community, with the public, and with you here today. So without further ado, we are going to go ahead and start today's program. So today we want to first kick it off with, how do you get in touch with Social Security? What is the best way to get in contact with us? Because of course, whenever you have Social Security business, you're going to want to know what is the best way to get in contact with us and what are the alternatives. So Megan, what is the first best method to reach Social Security?
Okay, well, thanks for asking. And I'm sure if you've tuned in to Josephine before, you might know what I'm going to say. It is online through ssa.gov. So that's ssa.gov. And the really important part is making sure that you go to the .gov, because there are other websites out there that are not Social Security. So this website is a great resource to reach us, get your information, get your questions answered. You can use the search box to find a variety of topics and great information. But we know that not everyone can use our online services. We understand that. We're still here there for you. By phone is the next best thing. So if you call our toll-free number, that's 1-800-772-1213. You can get information in both English and Spanish through our toll-free number services. And then finally, there is still availability to visit us at our offices. We are open Monday through Friday, 9 to 4, except for federal holidays. And that is, if you're not able to use online, if you're not able to use phone, then you can visit us in our office.
That is great information for all of our viewers to know here today, Megan. So thank you for sharing that. So there you have it. That is how you get in touch with us. Of course, the best way to get in touch with us, as Megan mentioned, is by visiting us at ssa.gov online. And I do want to also mention that we have services available in different languages. So if you are an individual who would like to speak to a representative in a different language, please let us know. We do have translator services available for you. So we want to make sure that we let everybody know that here today, because we certainly can go ahead and assist you in whichever language you are most comfortable in. And I also want to mention that on our website, we can go ahead and convert the website to Spanish. So if you are an individual who speaks Spanish and you go to the upper right on the website there, see, you look right here, it says Español. If you go ahead and click on Español, if you're an individual who would like to see the website in Spanish, you can go ahead and click there and it converts the website in Spanish, as you can see here. So I wanted to mention that to our viewers here today, because if you are interested in viewing the page in Spanish, you can certainly do so. So we want to go ahead and move right along. Now that we know how to get in contact with Social Security, we want to talk about, Megan mentioned the in-person opportunity, or that in-person option, because we understand that sometimes individuals may not be able to communicate with us via online or via phone at that 1-800-772-1213 phone number. So we want to make sure that you know that we are here for you. So you can visit us in person at our local field offices. But you may be wondering, okay, well, how do I know where my local field office is located? And the way you would know if where your local field office is located is by visiting us on our field office locator website. Megan, can you share what that field office locator website is?
Yes, and you know what? I use this website all the time because, as we discussed, you and I cover the suburbs, and oftentimes I'm not sure which office services that particular suburb. They have so many, the lines are blurred. So I go ahead and I go to the ssa.gov/locator, and I put in the zip code of whatever city I'm looking at, and it tells me which local office is. So this is a frequently used site on my computer, on my phone, when I'm out at events. I love this site. It also gives you not only the field office address, sometimes it gives you the phone number, sometimes you're going to get the 800 number, depending on the volume that local office has for calls, but also the fax number. And we really like that fax number. If you need to submit something that doesn't have to be a certified document, that's the way to go, because it's going to go right electronically to the office to be assigned whoever needs that document. So there's a lot of great information. Also on that locator, you can click on and get additional community resources in your area that'll be helpful for you. So it's a great tool to use on our site.
Yeah, definitely. So there you have it. That's how you find where your local field office is located and any additional resources that you may be interested in. So please feel free to visit that site and enter in your zip code so that you can find out where your local office is. But let's get to some exciting news. We have an update that Miss Megan Forristall is going to share with us, and we're going to do drum roll. Megan, what is that awesome update that we have for everyone today?
Well, last Thursday, we announced our cost of living increase, and we know from being out in the world that we get this question all the time. How much is it going to be? When are we going to know? And so we can tell you now that your cost of living increase for individuals receiving Social Security and our needs-based program supplemental security income, it's going to be 3.2% for 2024. So is there a way to find out what my new amount is going to be, Josephine, before I get that letter in the mail? Because I know we're going to get that question a lot too.
I am so glad you asked, Megan, and thank you for sharing that percentage here with all of us. So there is a way to find out what that is going to be for you specifically if you go online and you create your My Social Security account. And I encourage everyone here who's viewing, we encourage everyone here who is viewing, if you do not already have a My Social Security account, to create one, because this is how you will be able to see your letters. If you create one before, I believe it is November, either the first week of November, second week of November, you want to do this ASAP. Create that My Social Security account so that way you can see that notice in your online account. Now, of course, if you don't get a chance to create the account before November, that's okay. You will still get that notice in the mail. But if you want to see what that amount is going to be ahead of time, you most certainly want to create that account ASAP. And that's that My Social Security account that you can create on our website at socialsecurity.gov.
Yeah, and there's a lot of other things that change when we announce that cost of living increase as well. So whenever our amounts go up for our benefits, then things like the earnings estimates you can use for when you're working and under your full retirement age, they're going to increase. And a variety of other figures we use. The max taxable earnings you're going to pay into, all of those figures go up. And so what we have on our website, we have the press release that we got out to as many people as possible last Thursday. Now, last Thursday was my dad's birthday. So if you ask him what the most important thing was happening that day, he would still probably say the cost of living increase because he was wanting to know what it was too. But with that press release, which is on our site, they're right there, latest news, and we know that's a big one. If you click in there, There's also going to be a link to a fact sheet toward the bottom. So you can get, what can I make next year when I'm on benefits? What's the new taxable amount? For individuals who are receiving from our disability program, how much is what we call substantial gainful activity? All those new figures are going to be toward that bottom link where it says, here's the fact sheet. And so we have a lot of great information there to check out. And it'll compare 2023 and 2024, so you can kind of see how these increases work. Really great tool. I have mine printed up to take to all my events.
Yeah, that is awesome. Like you mentioned, Megan, a really, really, really great tool. And you can find all this information right on our website. You can see it here. Visit us at ssa.gov and you can find that information. So we wanted to make sure that not only are we giving you the information here on CAN TV, but we're also sharing with you where you can locate this information. But we also want to talk about Medicare today. We want to touch on what Medicare is, the enrollment periods, and we want to share with you what the 2024 new Medicare Part B premium is. So let's go ahead and dive into Medicare next. So we want to make sure that we give this reminder because our partners at Medicare ask us and would like us to help with sharing this information. So as of October 16, 2023, Medicare open enrollment runs through December 7th of 2023. During this time, you can review and compare your options for health and prescription drug coverage. After checking your options, you can enroll or switch plans for the coming year, and changes will take effect on January 1st of 2024. If you are satisfied with your current healthcare coverage, it will be available in 2024. You do not need to take any action. So we want to encourage you to visit medicare.gov or call 1-800-MEDICARE if you have any other questions or if you'd like to look more into the Medicare plans. But let's talk about what is what is Medicare? What are the different parts of Medicare? And what do we help people enroll here at Social Security? Because there are 4 different parts of Medicare, which we call traditional Medicare. And I'm going to go ahead and pass it over to my colleague, Miss Megan Forristall, so she can go ahead and share. What are the 4 parts of traditional Medicare?
Well, we have a little bit of an alphabet system with these parts of Medicare, Josephine. We're going to start with Part A. That's hospital insurance. Now, we go to the hospital, we think, oh, that's automatically Part A. But if you're going to the ER, it's not Part A unless they keep you overnight. So the key is this is overnight or longer coverage for inpatient hospitalization. Now, most people, they don't pay anything monthly for this as long as they have credits enough for their retirement benefit or they're receiving off a spouse or former spouse. They're going to be able to get this with no monthly premium. Others do have to pay if they do not have those credits. But the thing that everyone starts with looking into paying is the Medicare Part B insurance. There is a base premium for that for everyone. Some people get help from the state with this, but we do charge everyone through this system. So Medicare Part B, that's a lot of different things. So your outpatient visits, outpatient procedures, certain medical supplies. And we always say, well, go to medicare.gov to learn more about those because we're going to help you enroll in Part A and Part B at Social Security, and then we're kind of out of the business on all those Medicare questions. Then what happened is several years ago, we started having these Medicare Advantage plans. Those are Part C. And what happens then is we're still going to get you in the A and the B at Social Security. Still a very important step. But then what happens is the private company is going to take over on all of the other parts of the Medicare. Sometimes people can get vision, hearing, dental, so they like those plans. But we don't handle anything with those at Social Security. Generally, the Part C will also have a D. I like this one. It's easy to remember because Part D is for drug plans. So prescription drug plans is Part D. You can have that alongside Part C or just with your A and B as well.
Wow, that is great information to know, Medicare. Megan, thank you for sharing this great information about Medicare. And, I like that you mentioned that some individuals do get assistance for Medicare Part B because, yes, Part A is generally free for most of us as long as we've paid into Medicare taxes. But for all of us, we must pay a premium for Medicare Part A. Or Medicare Part B. So Part A is free for most of us. Part B, there's always a premium associated with it. But if you are an individual who has limited income and resources, if you visit your Department of Human Services or public aid, there is an application there that a person can fill out and complete. And if you qualify for assistance, what will happen is the state will pay for your Medicare Part B premium. So this is available for some individuals because, Megan, a lot of times I have people come to me and they say, you know what, Josephine, I know I'm in my initial enrollment period. I want Medicare Part B, but I just simply am not able to pay those premiums right now. What can I do? How can I obtain assistance? And so we want you to know here that there is assistance out there for individuals who are in need of extra help. So you can always visit the Department of Human Services and they can go ahead and take an application. And then if they approve your application, then they will pay either some or all of your Medicare Part B premium.
Mm-hmm. Thank you. And you know what? There's another group that actually helps people get into those what we call Medicare savings programs to help pay for the Part B. And they are our friends at SHIP, the Senior Health Insurance Program. We love SHIP because we can refer people. They are free. They're not selling you anything. They're helping you, guide you to what prescription drug plans, Medicare Advantage plans, and that state help for paying that Part B premiums. So we just great resource that we work with quite a bit with the state level and the local counselors because we love that we can trust them to not be selling one plan over the other. And so that's another great resource to use. They help with that open enrollment you were telling everyone about too. They are very busy right now with the open enrollment because people need to know how much can I save. Maybe I got a new drug I was prescribed this year. That's all stuff. Unfortunately, at Social Security, we're out of that. We can't help with that. But that's why we rely on our friends at SHIP, the Senior Health Insurance Program. There's in every state. We're going to go ahead and give you a phone number for Illinois to start with. Illinois is 800-252-8966. And then also for our Indiana viewers, if we got some on the other side, we're going to have 800-452-4800 in Indiana. And again, that's our SHIP friends that will help you with all of this complex stuff that we've been talking about because we're only here for a short time today and we know we're going to need some more assistance in getting through all this Medicare information.
Yeah, thank you so much for that great information, Megan, because yes, our Senior Health Insurance Program coordinator friends, they do provide lots of great assistance. So we wanted to make sure we shared that phone number with you here today. But I know you mentioned enrollment, Megan, so I want to touch base on what those enrollment periods are because many times people will ask us, well, what are the enrollment periods? When do I become eligible for Medicare? What are the different enrollment periods and can you help me understand them? That's one of the big questions we receive when individuals are approaching Medicare age. So Megan, can you share with us those 3 different enrollment periods?
Yeah, absolutely. So first we have your initial enrollment period. So this is when we're talking age 65. That's the earliest based on age you can get into Medicare. Your first opportunity is the 3 months before you turn 65, the month of your birthday, and the 3 months after your birthday. If you already receive a monthly Social Security check before 65, you're going to get your card in the mail automatically about 4 months ahead of time. But we know you're also getting a ton of mail at that time. Everyone in the world seems to know you're turning 65. So open your mail carefully if you're in that situation, because a lot of people we think accidentally throw that card away. Be on the lookout for it. But if you are not receiving monthly benefits and you need to get into Medicare, you need to do that in the initial enrollment period. And to get it the first day of the month in which you turn 65, you need to do it in the 3 months prior. If you wait till the month of your birthday or any of the 3 months after, the coverage is going to start the month after you enroll. So that's your first opportunity. But sometimes people aren't in need of that coverage. They might be still working and they're like, I don't want to pay. We haven't said it yet. This year is $164.90 a month for Part B, and some people pay more. I don't want to pay that. Why should I have to pay that? I'm still working. Is there an option for people who are still working? Is there any other enrollment period they could use, Josephine?
Oh, yes, there is. So now that you've provided us with the initial enrollment period, and we know when that is, 3 months before you turn age 65, the month you turn 65, and 3 months after you turn age 65, that's the initial enrollment period. But as Megan mentioned, what if I have insurance through my employer's group health plan and I'm actively employed? Can I wait? Can I delay enrolling in my Medicare Part B? And the answer to that is yes. There is what we call the special enrollment period. So this is the second enrollment period, the special enrollment period. So if you are actively employed and insured through your employer's group health plan, or if you are insured through your spouse's active employment and their employer's group health plan, then you are covered for that special enrollment period. And so what that means is that you can wait and delay taking your Medicare Part B past age 65. You just have to prove that you had that active employment and insurance through the employer's group health plan when you decide you want to take Medicare Part B later on, past age 65. And you have an 8-month window from the date that either the employment terminates or the insurance terminates, whichever event terminates first. You have an 8-month window to apply for Medicare Part B during the special enrollment period. Now, if you do apply for Medicare Part B during the special enrollment period, there are 2 forms that you will need. You will need the 40B form, which is the form that you fill out and you place on there what month and year you want your Part B to start. And then there's the L564 form. And that form is a form you provide to your employer, and then your employer fills that out, basically stating that you were actively employed and insured through your employer's group health plan, or that form is filled out by your spouse's employer, basically stating that they were actively employed and you were insured under their employer's group health plan. So that is the special enrollment period. But we want to get to that last enrollment period because, Megan, what happens if I missed my initial enrollment period and my special enrollment period? What do I do then?
Oh, that's a stressful situation sometimes.
Yes.
But we do recognize that not everyone is able to get through to us, or maybe they had some misunderstandings. Or maybe they just were kind of playing a little game to see how long they could wait till they got into some health insurance. So if somebody does not qualify, they missed their initial enrollment period, they don't qualify for that special enrollment period, we're then going to have an opportunity once a year for them to get into that Medicare Part B with their general enrollment period. That is January through March of every year. So that's when, if the situation didn't work out around the first opportunity, can get into Medicare. We do have a little bit of a penalty that goes on to those monthly premiums. It's 10% per year for every year someone didn't have the coverage. But on the good news side, we had some changes with that general enrollment period in 2023. Used to be you had to wait till July for that coverage. Now, starting this year, when you enrolled in the general enrollment period, the coverage begins the following month. So if you get in contact with us in January 2024, we can get you started with February 2024 on that Part B. Or anytime in that general enrollment period, it's going to be the month later.
That's great news. So that is great news. That is a plus as far as it starting and being effective right away for you. But keep in mind that during that general enrollment period, you can apply for that Medicare Part B January 1st through March 31st of any year. Sometimes people ask us, well, does that penalty follow me for life if I enrolled during the general enrollment period? And we want to make sure that you are aware that, yes, that penalty does follow us through life if we do enroll during that Medicare, during that general enrollment period for Medicare Part B. So we wanted to share a little bit about those enrollment periods with you here today, but we also want to let you know that the information is available on our website at ssa.gov. So all of this information is available on our website. We have a specific Medicare section on our website that you can find more information on the initial enrollment period, special enrollment period, and the general enrollment period. So I know Megan did mention that Medicare Part B cost for 2024, but we want to make sure that we mention that again here because that did change. So
more breaking news.
More breaking news, because for 2023, the standard Medicare Part B premium for this year was $164.90 per month this year in 2023. So Megan, what is it again for 2024 per month?
$174.70 a month for Part B in 2024. That came out the same day as our cost of living increase, which I don't think has happened in my few years as being a public affairs specialist. We usually have to wait a little longer. So that was really exciting that Center for Medicare and Medicaid Service followed our lead and got that announcement out early for people to plan ahead.
Absolutely. So a lot of new information, and we wanted to make sure that we came here to you today with this new information so that you are aware of it and familiar with it. But, you know, as much as we love to talk about Social Security's benefits and programs, we have to wrap up today's show, Megan. But before we leave you here today, we want to make sure we reiterate and encourage you to enroll in or sign up for your My Social Security account if you have not already done so, because that is your window to your My Social Security information, and it's just so critical to have that access. We also want to leave you here with today that there are individuals out there claiming to be Social Security representatives. However, they are not. They are aggressive. They are threatening. They're asking for your personal information. These are scammers. They're trying to obtain your information. Here at Social Security, our representatives would never call you out of the blue and never threaten you. So please just hang up if you receive a call like that and report it to oig.ssa.gov. So thank you so much for being here with us today, Chicago. And to all of our viewers who are watching here today, we thank you. And Megan, thank you for being here today.
Thanks so much for having me. This is fun.
Yes. So take care, everyone. Stay safe and stay well. And until next time, Josephine Mueller here and Megan Forristall wish you a very great day. Goodbye, everyone.